I'm Greg Ewald. I'm a cardiologist here, and I've been involved with the heart failure and heart transplant program for a number of years and been the medical director of the transplant program for the last several years. The program started in 1985, that's in a time period where a lot of other programs were starting. I think the program at St. Louis University started in that same ballpark, and really followed on kind of the, historically at a time where the kind of the pioneering group at Stanford had, kind of proven that it can be done effectively, and kind of started to work out some of the issues around transplant. And so a number of transplant programs across the country, I think, started in the early 80s. Barnes was one of those. I always find it interesting. I talked to some of the patients who were transplanted in that early era, and kind of asked them, what their expectation was when they got transplanted. And they said many times the physicians told them, and this was true because they really didn't have a big experience to draw from. The physicians told them, you may live 5 years from this. You may live a few years from this. They really didn't know what to expect, and the history of heart transplant was, they were kind of making history at that point. There really wasn't a good track record to know what was going to happen to a transplant recipient. Barnes has been very supportive of transplant as one of its missions, not only in heart but other solid organs, and so I think we benefit from that as well. And in fact, some of our patients have gone on to need a kidney transplant, gotten a kidney transplant, so having a robust kidney transplant program is important. The infrastructure that the hospital provides in terms of nurse coordinators and people with a lot of expertise of taking care of these patients is also critically important. So it really takes a dedicated team of people of all different specialties to manage this. From a sort of a heart failure perspective, we now manage patients a lot of times with mechanical assist devices that stabilize them while they have heart failure and really allow them to wait for a transplant and wait at home instead of in the hospital, so to speak. When I first started, there was to be listed in kind of the higher levels of the waiting list. The sicker patients had to stay in the hospital and stay in an ICU setting, and so we had guys in the hospital or patients in the hospital sometimes for months waiting for their heart transplant, and we rarely have to do that these days because we can support them with mechanical devices, and they can sort of come back at a more elective time to get their transplant. One of the things for me that I find very enjoyable about this job is I take care of people who were very, very sick, very limited, and then to be able to see them have this kind of almost miraculous turnaround over the course of several weeks or months is actually really enjoyable. And so to see them, a year later, 2 years later, to have them tell me, I've seen, grandchildren born, or I've gone able to do these things that I didn't think I'd ever be able to do, I think is really a, rewarding part of what I do. So I think the patients, expect to have a significant improvement in their life. Obviously, one of the key things is that transplant is not a cure for their heart disease. It's really a big treatment, and so there's medical issues and medications and procedures and things that have to happen really for the rest of their lives to achieve that success. But I think if you kind of look at it that way, it's just a major surgical treatment for their heart failure, then that's they're usually happy with that. So one of the issues we still face, I think we'll face for a long time, is just that there aren't enough donor hearts to go around. So I mean, our program's no exception, but we have several people waiting more than a year to get a heart transplant. If we had more donors, we would do more of these operations and take care of more people in that way. So I think whether that'll change in a big way, it's hard to tell. It really hasn't changed over the years, even though there have been a lot of efforts by various groups to raise awareness of the donor situation, not only in heart transplant but other solid organs. Whether we'll ever get to a place where we can use stem cells or grow, make a heart out of something that we could put into a patient, I don't know. But things, if you're talking about 25 years, you could certainly see a situation where we'll be able to engineer an organ and transplant that into a patient without having them to wait, for a sort of an altruistic donor to come along. I think these mechanical devices are going to rival transplant. I mean, the devices are getting smaller and smaller. They're getting more durable so that they last longer and longer. And so there may come a time where we won't be necessarily so dependent on a heart transplant. We'll actually put a mechanical device in somebody and really have that expectation that they could live 10, 15, 20 years just like our transplant recipients are doing. Even though I've been involved in a number of heart transplants here, I still think, it's like, wow, this is still a pretty amazing thing to think that, you've taken a heart from somebody else, you've actually had the surgery, and when you go watch one of the operations in the operating room, to kind of look down in somebody's chest and see no heart there is an amazing sight. And then get a transplant and have that work well. I still think it's practically a miracle every time I see it.